Hi, I'm Jason Bellamy, coming to you from Orlando, Florida, and APTA's next 2018 conference. And I'm joined by Stephen Hunter. And about a little over 90 minutes ago, we were in the Rothstein Roundtable, which is an annual event here, a panel discussion. You were part of that panel discussion.
Yes.
Tony DeLito moderated the panel. And what we talked about, or what was talked about, I didn't participate. I sat and listened and learned. What was talked about was the opioid epidemic and how that is affecting change in who needs to affect, first of all, who gets physical therapy, right?
Right.
But also, how do we incentivize that? How do we make that easier? How does payment evolve to make that better? So one of the things that came out early on is this concept that the data that shows that people who get conservative care like physical therapy are going to get safer care, first of all, but also potentially lower costs to the healthcare system overall if they start physical therapy early, has been there for a while. And yet, it's only recently that we're starting to see things slowly evolve to sort of having people get access to physical therapy early on for many musculoskeletal conditions. Why is that evolution happening now?
Well, as was mentioned in the roundtable, the reason it's happening now is the opioid crisis.
Yeah.
So that I think it was referred to as, we had the fuel there, but the opioid crisis lit the match to that fuel. So that's, we've gotten a lot of national exposure, a lot of political exposure. So I think that's why it's come to the forefront. The problem is there's a lot of barriers to getting, therapists, therapy seen early in the episode of care, and so that's what's I think the challenge going forward is those barriers.
So we talked about those barriers, and it's everything from patient expectations, which I want to talk about later, to obviously, payment, whether it's covered by insurance or isn't. But one of the things I thought was absolutely fascinating, I think you spoke about this from your experience with Intermountain. There's this perception, of course, that basically physicians are just not referring to physical therapists, and they're kind of the bad guy in this. And you guys said you wouldn't have these conversations and said, no, we're referring, and you said sort of couldn't be true. Take me through that story.
Yeah, so what happened is Intermountain recently went over to a new EMR, and in that EMR, physicians can make referrals directly to the EMR, so they don't have to hand the patient a paper script. They just put it in the system. And so in the past, they'd hand the patient the paper script, and we assumed those patients all went to therapy. And what we learned from the EMR now is they're not. So that the physicians are actually referring a lot more patients than we thought they were, and patients simply aren't going to their therapy appointment. They're not scheduling an appointment, and they're not going there for several reasons. I mean, the biggest one is cost. I mean, if they have a high deductible plan or they have a high copayment, then they're just like, I can't afford to go to therapy, so they don't even schedule. Since we have that referral in the system, we'll call them and we can sometimes work through some of those issues. But what we learned is that physicians may not be the bad guy. They may be referring, just like they said they've been. It's the patient that doesn't want to go. And
so there's a bunch of ways to change that, right? And the most common way we talk about, which is undeniably important, is just in the general sense, increasing public awareness about what physical therapists can do and the value of that care. But usually, when we have that conversation, we seem to have it in the sense of, we'll raise awareness, and then the consumer will make a choice and go, and that problem solved. And I think it was you who said, there's data to suggest that even the patients who select physical therapy sometimes don't quite understand why they're there. Do you remember that from the dialogue?
Yeah, I think we could do a better job, especially on the initial visits with our patients, to explain, okay, you're coming to therapy, do you understand what that means? And what are your expectations? And we don't always do a good job of that. I think if we lead out with that, then it gives us a lot of information. One, it lets us know what the patient is expecting. It may be something quite different than what we are going to deliver or we think the patient needs. But the other thing it does is it gives us information about the patient's understanding of physical therapy. Some patients just think, we're a glorified massage therapist, and they don't understand how detailed the assessment is, how specific we apply treatment and exercise, that we do other things, a lot of manual therapy approaches, and when patients understand that, I think that they'll start to recognize the values a lot better.
And physical therapists have a pretty rare opportunity to do that, considering that most physical therapists will see their patients for much longer, for example, than a physician will. So it's all that time that you could be using to talk about the process that they're in. So that's an opportunity that's right in front of physical therapists today to increase that awareness. But let's talk about those patient expectations. One of the things that led to the opioid epidemic as well was the patient expectation about what they were going to get. Right. So it's pain is bad, I'm in pain, I want the pain to go away immediately. Physicians were expected to address that pain essentially immediately, and the easiest way to do that was with opioids.
Yeah.
Okay, on the flip side, physical therapists can't fall into the same trap, and that was another conversation that came up, which is there's a responsibility of the physical therapist clinician to, if the patient comes in saying, I want X treatment, fill in the blank, dry needling was used as an example. Right. That may be the appropriate determination, but it should be the appropriate treatment because the physical therapist decides it is, not because the patient's dictating their own experience. I mean, can you talk about that as the healthcare shifts, physical therapists can't fall into the same trap that led to too many opioids?
That's right, and again, that comes back to patient, setting up patient expectations, engaging the patient in their own care, using evidence to help educate the patient. So, for instance, a patient may come in and say, hey, I've heard about this new technique, or dry needling as an example, and that's what I want. And the therapist may determine, well, that's not really the most effective treatment for you. Well, that may require working with the patient on, maybe that's something we can try, but can we start with this? The evidence shows that, maybe this treatment is going to help you, and we want you to get better as fast as you can, which is what you want, so can we try this first? And if that doesn't work, then maybe we can look at other options. But I think it comes back to just getting the patient engaged in their own treatment, sharing information with them, and also using, our evidence to educate them.
So to have evidence to educate them, you have to have outcomes, right? You have to have data that you're looking at. APTA is taking an initiative there with the Physical Therapy Outcomes Registry to try to create the largest national database of physical therapy outcomes. Intermountain has done a lot around outcomes. Also mentioned there was a participant from United Healthcare and Optum. APTA has engaged with them, and that's leading to a very large study, which the data is going to be available in a journal later this year. And they're going to do pilot programs, basically, to waive some copays in areas for low back pain treatment to get people access to physical therapy first, which is tremendous. But the other part of measuring what you do is sometimes you're going to be surprised by the results. And Chuck Thigpen was one of the PT clinicians who was there, and he talked about, times that he looked at the data and was shocked and hurt at times that he did not have the outcomes that were as positive as he expected. How do we prepare for that as a profession? Because we're going to start getting much more immediate and real and specific feedback, and how do we respond to that?
Yeah, that is a great question. I think for individuals who have used registries and they're adding new therapists to that registry, I think that's the biggest fear that they have, is that the information from the registry will shock the therapist to say, wow, I thought I was doing a lot better. Of course, excuse me, it's easier to remember the patients that are successful and not the ones who fail. But when you measure things, you realize you're maybe not quite as good as you thought you were. But if you look at that as an opportunity to say, okay, we're not doing maybe as well as we want, but we have this opportunity to improve, and then you can really look at the data over a period of time. Trend data, I think, really helps our therapists recognize, look, we started here, maybe it wasn't that great. We've maybe standardized care. We've changed the way we do things, and now it's a lot better. Then I think that's what can help motivate therapists.
So I'm going to give you one more question. I'm going to tell you what it is now so you can think while I say this next part. My question was if you sort of had an aha moment sitting there. But before you answer that, it was a tremendous discussion, and the good news is you didn't miss it. So PTJ will have a video of the entire discussion, a podcast version of the entire discussion, and PTJ editorial staff is hopeful that'll be available within the month of July. So look out for that. I think it's a conversation that will inspire you and make you feel very positive, and also challenge you and hopefully motivate you to make the physical therapy profession better. And I say that to giving you time as you listen to all the diverse perspectives. So there's sort of a wow moment for you today.
Yeah, there was. I mean, we've been working with a local payer for years to try and help break down the barriers to get therapists in sooner, and also, or get patients in sooner to therapists, and also to have those patients, complete their therapy, essentially. Again, the big barriers are co-payments, deductibles, and to really hear that United Healthcare is piloting eliminating or waiving co-pays so that that cost is not there, it's not a barrier, was really exciting. And I think they're talking about doing that this year.
Yes.
So that's exciting. And United being the largest payer, the commercial payer in the U.S., I think once they start to do that, other payers will follow suit. And they recognize, United recognizes that by waiving a copay, that's a drop in the bucket to what they're going to save downstream, because when our patients get into therapy early, then the downstream savings with injections and medications and surgery is significant, many times what the copayment would be. So that was an aha moment. It was exciting to see that payers are stepping up and really becoming innovative to break down barriers to have our patients get in soon and to complete their care.
Yeah, and again, so the scientific data that's motivating those changes, that's going to come out sometime later this year in a scientific journal. But that pilot, it's still coming together. APTA was influential in helping to make that happen, working with United Healthcare and Optum. And APTA is going to be reporting on that soon, but it is a hugely exciting thing. So anyway, look for the Rothstein Roundtable, because you're going to want to listen to all this in full. It was tremendous. That'll be available through PTJ. For Stephen Hunter, I'm Jason Bellamy, and we're going to be right back momentarily with this year's Maley Lecturer. I'll catch you later.
Thank you.